Hey, welcome back. Today, we are tackling something that's, well, incredibly common, human papillomavirus, or HPV. We're going to break down what it is, what the real risks are, and, this is the important part, how we can actually fight back. But before we get into the weeds, let me ask you this. What could 6 totally different types of cancer possibly have in common? We're talking cancers that affect both men and women. The answer? It's kind of wild. It's a single virus. And we're about to dig into how that even works. So, here's our game plan. We'll start with the virus itself, then see how it can turn into cancer. We'll look at everything it can cause, from warts to cancers, talk about treatments, and wrap up with the real game changer, prevention. All right, let's get right into it. Part 1, the common virus. And when I say common, I am not kidding. We're talking about human papillomavirus, and the numbers are kind of staggering. Get this, almost 80% of sexually active people will get an HPV infection at some point. Yeah, 80%. So you can see why it's so important to understand what we're dealing with. Okay, so the big question is, if it's so common, how does it get so dangerous? That leads us right into our next section, from infection to cancer. You see, the good news is, most of the time, our bodies just clear the infection, no problem. But when it sticks around, that's when the virus can basically hijack our own cells and start pushing them down a really bad path. Let's take a closer look at that process. This image here tells the whole story, really. If you look all the way to the left, that's what normal healthy tissue looks like, the squamous epithelium. But then, see those little red dots? Those are the HPV particles, and they're sneaking into the deepest layer of cells, the basal layer. And that, right there, is the starting point for all the trouble. So let's just walk through that progression. Step 1 is the infection itself. The virus gets in. Then, over time, you might get what's called a low-grade lesion. Think of it as early, mild changes to the cells. Now, if your immune system doesn't kick the virus out, it can get worse, progressing to a high-grade lesion. That's when things get precancerous. And the final step? That's invasive cancer. It's when those abnormal cells break through their boundary, that basement membrane, and can start to spread. But you know, cancer isn't the only thing that can happen. And that brings us to our next part, where we zoom out and see the bigger picture. We're going to look at the whole spectrum of diseases linked to HPV, which includes stuff that's benign all the way to those really serious cancers. And this table lays it out perfectly. You've got your high-risk types of HPV, and those are the ones linked to cancers: cervical, vulvar, vaginal, anal, penile, and even throat cancers. But then you've got the low-risk types of HPV, and they're responsible for something much more common: genital warts. So let's zoom in on genital warts for just a second. The fancy medical term is condyloma acuminata. These are usually caused by those low-risk types of HPV, specifically types 6 and 11. They typically show up as these multiple pink or skin-colored spots. Now, how they look can really vary, but sometimes these lesions are what's called exophytic, which just means they grow outward from the skin. And the description that really sticks with you is that they can sometimes form these, well, cauliflower-like growths. It's a very memorable and, frankly, accurate description. Okay, so if the virus causes these issues, what do we do about them? Well, that moves us right along to treating the symptoms. And it's a really key point here. We're treating the conditions caused by HPV, like the warts, not the actual virus itself. Let's get practical. If someone has genital warts, what happens next? What are the treatment options? Well, the good news is there are actually several really effective ways to manage them. Generally, the treatments fall into 3 buckets. First, you've got chemical treatments, things like special acids that are put right on the lesion. Second, there are immunologic therapies, which actually help your own body fight back. And third, you have surgical options, like freezing them off, using a laser, or just cutting them out. I think the immunologic approach is just fascinating. A cream like imiquimod doesn't actually attack the wart directly. Instead, it gets your own immune system fired up. It's basically like a training program for your body, teaching it to find those virus-infected cells and get rid of them. Your body is doing the heavy lifting. The chemical method, on the other hand, is much more direct. A healthcare provider applies a substance like trichloroacetic acid, and it pretty much does exactly what it sounds like. It chemically injures and destroys the wart tissue. So deciding on the best approach really depends on a bunch of factors, and it's always a conversation to have with a doctor. Look, treatment is great, but you know what's even better? Never having to deal with it in the first place. And that brings us to our final and honestly most critical section, Prevention is key. We're talking about the ultimate solution here. And the single best tool we have in our arsenal for prevention is the HPV vaccine. And if there's one number to remember for routine vaccination, it's this one: 11 to 12 years old. That's the sweet spot, the recommended age to get both boys and girls vaccinated long before they're likely to ever encounter the virus.
But it's not just for preteens. Not at all. As you can see here, there's catch-up vaccination. It's recommended for girls and women all the way up to age 26, and for boys and men up to 21, or even 26 in some specific groups. And it's also especially recommended for anyone with a compromised immune system, like people with HIV.
So let's just end with this thought. We literally have a vaccine that can prevent cancer. Not just one type, but 6. It's one of the most incredible public health achievements ever. It really just makes you stop and think, what on earth will we make possible next?